What high blood pressure? High blood pressure is a common condition in which the long-term force of the blood against your artery wall is high enough that it may eventually cause health problems such as heart disease. Blood pressure is determined by the amount of the blood your heart pump and amount of blood flow in your arteries. The more blood your heart pumps and the narrow your arteries, the higher your blood pressure will be. You can have high blood pressure, hypertension for years without any symptom. Even without symptom damage, the blood vessel and your heart continue and can be detected. Uncontrolled high blood pressure increases your risk of serious health problems, including heart attack and stroke. High blood pressure generally develop over many years and it affects nearly everyone eventually. Fortunately, high blood pressure can be easily detected, and once you know have high blood pressure, you can work with your doctor to control it. What are the symptoms? Most people with high blood pressure have no sign and symptom. Even if blood pressure reading reach dangerously high level, a few people with high blood pressure may have headache, shortness of breath, or nosebleed, but these signs and symptoms aren't specific and usually don't occur until the high blood pressure has reached a severe or life-threatening stage. When to see the doctor? You would like to visit the doctor as soon as possible if you see such kind of symptoms. What are the causes? There are two types of high blood pressure: primary hypertension and secondary hypertension. For most adults, there is no identifiable cause of high blood pressure. This type of high blood pressure, called primary hypertension, tend to develop gradually over many years. Secondary hypertension. Some people have high blood pressure caused by an underlying condition. This type of high blood pressure, called secondary hypertension, tend to appear suddenly and causes the high blood pressure than does primary hypertension. Various condition and medication can lead to secondary hypertension, including obstructive sleep apnea, kidney problems, adrenal gland tumors, thyroid problems, certain defect you are born with in blood vessel, certain medications such as birth control pills, cold remedies, decongestant, over-the-counter pain relievers, and some prescription drugs, illegal drugs such as cocaine and amphetamine. What are the risk factors? High blood pressure has many risk factors, including age. The risk of high blood pressure as you age until about 64 years. High blood pressure is more common in men. Women are more likely to develop high blood pressure after the age of 65. Race. High blood pressure is particularly common among people of African heritage, often developing at an earlier age than it does in white. Serious complications such as stroke, heart attack, and kidney failure are also more complication in a people of African heritage. Family